proactive wellness, or only get to one thing, and that is to really make you aware of taking advantage of what can do proactively to be well in this day and age. You know, you can use the technology for your own use, but you have to combine some of the ancient wisdom so that you are balanced, right? So that's what I do. That's what I advise everybody. I cannot say I don't want to learn AI because I don't need it. That's the wrong approach. Use the technology to help more people. If you don't want anything personally for you, at least the communications are gone. Like how many people here I meet who I don't know personally, and if I have to wait to go and meet them, it will take me for years. I'm in Iowa, and I don't know whoever is wherever, and this is so convenient, right? Having this facility reach not just few people, but who knows who is here, seeing the replays, maybe around the world, right? So that is there because this Wi apps, they go around the world. So that is one thing. So use the technology, but also incorporate all the ancient tips. I kind of bring it in, and maybe some of them will work for you, if not all. Some of them may not be relevant to you. Also, that's also fine. So in that spirit, I will present tomorrow what is generally practice of pranayama, how the pranayama has evolved into various shapes, and maybe I'll give a hint of what each type of breathing will do to your throat, through your lungs, and through your general well-being. Right? Like I said, abhi karo, abhi pao means you do this now, and you get the benefits now. You don't have to wait for it also. So that will be a wonderful technique. It does help a lot during the times of stress. It does help a lot when you really having this nervousness for any reason. So I talked all of that in the morning talk, so you can go and listen to it if you want to. Generally, people want to treat themselves with the deep breathing when they are really slowed down by something that happened in their life, either um, accident or disease or something like that. So somebody relative or near one has some problem, but that may be delaying what you can get the benefits here and now. Okay, so if you have that kind of habit of deep breathing, and you bring it as a tool for your armamentarium of dealing with stress, anxiety, and depression, and so many other things, right? Usually, depressed patients don't have the motivation to do the all these exercises on by themselves, But if you can motivate them and they come out of that and they really need a good life, that is a good reward, right? That's how I look at it. So uh, if you have heard me, you can come up. If you have not heard me, then you can go and listen to the replay too. And then you can always send me the questions if you want to. Okay. So lots of times people don't really take interest, listen, and then follow up with that. Then what is the source that you have? Probably you have wasted, right? So I don't mind answering genuine questions. I don't mind questions that are really new or something that I have not seen ever, or I may refer you to the library of things that you could see by yourself. Okay, so so this afternoon I just wanted to come and tell you one more thing, apart from the Zoom session. For once again, for the people who joined me just now on the other channels too, I'm going to do the Zoom session along with the Noombite application so that people can hear me. So if you choose they can come on the Zoom and see me. So that way they can see practical demonstration of breathing. I'll be sitting at a table and will be looking directly at the camera, and I'll be doing them as though that's something that I'm shooting, and then you can go through with me all the steps. See, if I just tell you, okay, sit down and breathe, it's not pretty impressive. But if I tell you the posture, if I tell the prerequisites, if I tell the actual process, one step at a time, and then explain to you what are the advantages of doing like this, and then you finish it off, and then you relax. Okay, so there will be 10. Even if you just show them, it will take at least 30 minutes, right? So we may be there beyond 30 minutes, like 45 minutes maybe. After that, I will have this wellness club, so I will be leaving you. But I'm going to post the Zoom session. I think the same thing last time I put it. Some people call from outside, but they join, but not anybody from Mumbai, you know. But I think it's better to participate and see what is that we are demonstrating. You know, basically, I told you all those 10 different different breathing exercise we will do. You know, so it's a question of following and then doing them. But the thing is, it's not like a simple, common one thing. Some of these things have effect on your body, and really you have to focus on that. You know, so each one take a longer than 3 5 minutes, but we like to second. You know, so what I would tell you is, what do you do without that? You are doing the breathing, and then what is this technique, and then what do you do when these things are really uh, give problems to you? You know, side effects, that kind of thing. So we can go pretty deep on each one, but I will just touch them, just make people be familiar with it, and then let them reach me when they want. Okay. So the plan is to do the Zoom session along with the noon by tomorrow. Okay. And I have come up with a new because I was at a room last night in Clubhouse, and there were several people there that were. One of them had a real issues with the emotional ability, and he was actually ended up crying, you know, because he was asking so much things very aggressively, he wanted to dominate everybody. But then a couple of times he became very emotional, very upset because his life is like that. He told me that his life aim is to go and make as much money as he can. You know, the question is, will that give you joy and peace? So we were talking about that, and he was very happy, and he slept off. And then he woke up on the room later. You know? But you know, well, he had to reach out to these people and help them. So he was very benefited by the rapid breathing and also in and out breathing. Okay, so we will do that demonstration of 10 different breathing types. So one is uh, Vastrika, which is simple sitting down doing it, and Kapalabhati, which is you withdraw the abdomen as you exhale, and then you don't inhale. Then you just exhale all the air and then come out. Okay, that is Bhastrika. Then Kapalabhati, where you use abdominal muscles to expel air at the same time, and you do that up to 60 minutes in a day. Not in a day, 60 minutes at a time, right? All the 60 times will take maybe 2 or 3 minutes, right? And then we're going to do what's called a metabolic stimulator. This is called Agni Sara. Okay, that means actually you're stimulating the fire in your belly. Okay, so that's one thing you do. And then we do what are called bandhas. That is, the bandhas are three spaces like a lower abdomen, upper abdomen go in and stay there, and then you bend your chin and touch the chest. So and then hold the air for a few seconds, maybe 10 to 20 seconds. And then you do the up and down movement 20 times, right? So different varieties are there. There are so many other varieties are there. If you are familiar with them, if you want to have details, come up and talk to me. I'll be able to help you. Terry, Julie, Lois, I know all of them. They are there. There are other people too. Tony, Vandergaard, and Quad, True Julie, and Fake Inspector, and all that. Okay? So I'm here to engage you with any questions you have with the pranayama. So I will give you a few moments for you to muster the strength and come up and tell us what you know about it, what you like about it, or am I just beating on the bush, So you can tell me all that. These things are pretty exciting to me because I personally get a lot of benefit because of that. I'm aware. I have insightful things that happen, and I'm going to my own mind, and I have more energy. And that is definitely right after doing that. And then I'm more connected with everything. All these are benefits of deep breathing. Okay, so I hope I make some sense to you, and I would really recommend you not only learn these habits but bring them into your lifestyle. Don't spend too much time on talking to it or telling other people. Just do it and then see what the result you get. Okay. I'll give you a few minutes for people to come up. Otherwise, I'll have to close the room. Okay. Yeah. Somebody's coming. Let's see. Cecily, I think, is coming. Hi, Cecily. How are you?
Doing good. You can you hear me okay?
Yeah, a little low volume, but I can hear you.
I wanted to come up and ask you
Yeah.
about the breathing technique
Okay.
because I tend to get a little confused when we start talking about
Yeah.
the different positions of breathing.
Yeah, they're simple to complex. That's what I was proposing to demonstrate on Zoom tomorrow. But I can tell you the first one, which is a very simple one. This one requires a posture of erect spine, and you sit in any chair with your back straight. Don't lean into the chair, but just to sit in the front of the chair. And then you better off keeping your abdomen light, empty, right? Don't eat any big meal before the breathing, and go to the bathroom, empty bladder and bowel, and then. If you eat a small snack, you can do this exercise maybe up to 30, 45 minutes after. But if you eat a real big meal, then wait for 1.5 hours before you start this. Basically, the light stomach, right? And then, as you sit down, you close your mouth, and then you can close your eyes if you want to, and then take deep breath through nostrils. Slowly breathe in as though you are sucking the air from the level of the abdomen, umbilicus, right? So you slowly breathe in as the abdominal wall raises and comes out, right? And that is the diaphragmatic breathing, right? And then hold it for a few seconds, and then as you breathe out, make sure the abdominal wall goes towards the spine, thereby pressing the diaphragm up. And then you do that 8 times, and then you can have that kind of cycles 8 times at a time, in the morning, in the afternoon, in the evening, before you eat something. So if you do like this 3 times, this is the only one that can help you a lot. But you can do more complex ones if you are interested, and if you have other conditions, if you want to address such a particular thing, then we can do that. Okay.
Yeah.
Yeah. So look for the Zoom, and if you want, you can join there, and then you just click on it. You will see my yoga studio, and I'll be demonstrating these techniques, so you may pick up and you may do them on your own time. Okay?
Is the link in your bio?
It is there, but tomorrow at 7 o'clock it will be operational. Then I'll be there already open. Then you can join. Okay. Go to my link, please, and you will see that there. Okay. I just put it a couple of days ago, so it should be there. It's day video, something like that. I'm glad I have a chance to tell people that they can join, they can look for this link and see me actually doing that. So you will be hearing my voice also because this Mumbai will be open. I used to do this. I used to do yoga on Clubhouse and Instagram and Wisdom. I used to open on different devices, right? So I was able to be visible video with the Instagram. A lot of people used to come and do it with me. But the thing was, I could see them, but they cannot. They could see me, but I cannot really see them unless I invite them. And so many people I cannot invite, or two or three people on the Instagram I can invite, right? So that way I had only those people seeing me, but I was not able to see them. Then I opened this Zoom thing, and that went well because I was able to watch how they are doing and you correct them right away in real time. So, anybody else? Anybody has any other questions? Okay, just know that I'll be there tomorrow morning at 7 o'clock. You come and join me. Okay, bye bye.